Can you donate plasma while taking Tirzepatide? If you're on Mounjaro or Zepbound and wondering whether you can still donate plasma, you're not alone. And the answer is more nuanced than a simple yes or no. Let's break it down. Tirzepatide, sold under the brand names Mounjaro and Zepbound, is a dual GIP and GLP-1 receptor agonist. It works by enhancing insulin secretion, suppressing glucagon, and slowing how quickly your stomach empties. It's approved for type 2 diabetes and chronic weight management. Here's the key thing to understand up front. The FDA does not specifically prohibit plasma donation for people taking Tirzepatide. And unlike some older medications, like bovine insulin, which leads to an indefinite deferral, Tirzepatide doesn't appear on standard medication exclusion lists maintained by major U.S. blood organizations, but that doesn't automatically mean you're cleared to donate. Eligibility is determined by the donation center's medical staff, and they look at the full picture. That includes your overall health, how well your underlying condition is controlled, any side effects you're currently experiencing, and what other medications you're taking alongside Tirzepatide. If you're taking Tirzepatide for type 2 diabetes, the stability of your blood sugar matters a lot. Uncontrolled diabetes can affect your eligibility more than the medication itself. Donation centers want to see that your condition is well managed before you sit down to donate. There's also the question of side effects. Tirzepatide commonly causes gastrointestinal symptoms, things like nausea, vomiting, or diarrhea. If those symptoms are causing dehydration or electrolyte imbalances, you may be temporarily deferred until things settle down. Donating plasma when you're already dehydrated simply isn't safe for you. One more safety consideration: if you're taking Tirzepatide alongside insulin or a sulfonylurea, your risk of low blood sugar can increase during the donation process itself. Making sure you've eaten adequately before donating and monitoring your glucose carefully becomes especially important in that situation. So what should you actually do if you want to donate plasma? First, talk to your doctor before you go. Let them help you assess whether your health is in a good place for donation, your disease control, your side effect profile, and any other medications you're on. Second, consider calling your donation center in advance to confirm their current policies, since these can vary between facilities and change over time. And third, be completely upfront with the donation center when you arrive. Tell them everything: the name of your medication, what you're taking it for, any other therapies you're on, and how you're feeling right now. Full disclosure isn't just a formality, it's how the medical staff can make a safe, informed decision for you and for the people who will receive donated plasma. If you're experiencing active nausea, vomiting, or diarrhea from Tirzepatide, wait until those symptoms have fully resolved before attempting to donate. And if your blood sugar hasn't been well controlled recently, that's a conversation to have with your healthcare professional first. Let's recap the key points. Tirzepatide is not specifically prohibited by the FDA for plasma donation, but eligibility is decided by the donation center based on your individual health. Your underlying condition, especially diabetes control, and any active side effects matter more than the medication name alone. Call ahead to confirm policies, and always disclose your full medication history to the center's medical staff. Nothing in this video is a substitute for personalized medical advice. Please speak with your healthcare professional and your donation center before making any decisions about donating plasma while on Tirzepatide. Have you ever had questions about donating blood or plasma while on a medication? Drop them in the comments. We'd love to hear from you. And if this video was helpful, give it a like and subscribe so you don't miss what we cover next.